All right, today's talk, I'm going to start with a review of memory systems. And then I'm going to talk a bit about how memory and attachment is important. I'll move on to them then to talk about the etiology or the causes of trauma. And when I'm talking about trauma here, I'm talking about emotional trauma. I will try and link how trauma, emotional trauma lodges in memory and which systems are engaged. This is important because, and will move me to the most important part of my talk, which is looking at how psychotherapy does change traumatic memory systems and how short-term and long-term psychotherapy will be useful in different contexts depending on traumatic memory and which system it's lodged in. There's a lot of stuff that is unconscious or out of awareness. We used to call it unconscious in the old psychoanalytic, psychodynamic days, but now with cognitive theory, it's the same thing, but it's now called out of awareness because the brain only gives you so much awareness. Lots of things are out of awareness, things like really powerful, unbearable feelings are disconnected, things like terror. Terror is not fear. Fear is something you can feel and manage. Terror is unmanageable, overwhelming fear. Shame, powerful shame. Rage, again, rage is not anger. It's anger on steroids. It's anger that where you have no say. Because in terms of memory systems, this chronic disconnection or feeling of alienation that all my clients experience is this multitude of caregiver failure to connect with them, which is stored in implicit memory. And these memories, as I've said, are elaborated in stories. If you ask them about when did you first feel that, they will talk about explicit memory, about actual events that happened. And so what we're trying to do with this connection repair with thousands, which occurs thousands of times in long-term therapy, is build this complex and continuing new learning, changing implicit memory, giving the new capacity, which is experienced as self.